Are you ready to master the waves of medical device product development? Well, wax up your surfboard because you are listening to Inspired by Imua. And here is your medical device product development expert, that Hawaiian-hearted hostess who will help you hang 10, Meghan Alonso.
Komomai and aloha. You're listening to Inspired by Imua, where we help you master the waves of medical product development. Each week, we interview guests that educate, guide, and inspire to help you and your product hang 10. If this is your first time listening, Imua is spelled I-M-U-A, and it's a Hawaiian word. It means to advance forward with passion despite rough waves. There are plenty of those in the medical device industry, but keep listening because we've got you covered. So today's episode is a continuation from episode 36. If you haven't listened to that yet, that's a good place for you to start. Well, actually, in episode 36, I tell you that it's kind of related to episode 32 and 34. So you've got lots of listening to do if you haven't listened to those episodes before today's. And that's okay. If your style is to go out of order, then that's fine too. You can do that. No judgment. So I wanted to thank you all. I have had an amazing month. If you've listened and you've known what I've been up to, I've been putting together my new program called Invention Idea to Profitable Product. And it's launched. It's officially in beta. I have my beta testers going through it now. And the response that I got from all of my applications was just incredible. And I thank you guys so much. There was a lot of people that poured their heart and souls into that application. And it was so cool to just read about all the different products people are working on, and they need help. And I'm really excited to get started and help. If for some reason you didn't finish your application, or if you didn't get around to applying, that's okay. Because what comes after beta, well, then we officially launch it, which is coming next year. And if you get on the interest list between now and January 1st, then I will give you $750 off the program. So that's huge. That's a huge discount. Go ahead and take advantage of it now. You can sign up by going to imua-services.com/IIPP. That'll get you there. And that link, again, it's just valid through the end of the year, through December 31st, 11:59 p.m. So go ahead and do that if you're interested. You can take advantage of that. If not, the price goes up with 2017 on January 1st. Also, I want to give a shout out to my colleague, Brian Johnson, that always puts on great events. If you're in Southern California on December 12th, that's coming up very, very soon here, it'll be his event called Device Talks West. Will be in Newport Beach at the Fairmont Hotel there. Very nice venue. And he'll be intimately interviewing some of the top minds in the medical device industry. It's a really cool format, very well done, excellent food every time I go. So head on over to devicetalks.com. You can register there, and I'll be at the event, so you can stop by and say hi. All right, so for today's episode, we're finishing the process of what it takes to get a medical device to market, and how you even get startup funding for that to make all this happen. So I did an overview in 36 of just the process from this is what happens when you first have an idea. This is what happens when you're iterating on that idea. And then you move into verification and validation and launch. So we covered all that. We covered what is involved in those efforts, everything from what you should be focusing on from marketing to intellectual property, for engineering and regulatory. There's a lot. But what we didn't get into yet is some of the actual business strategy and pitching that it takes to get that startup funding. So we're going to look at that today. So we'll start out with business formation. So forming your business is packaging it up into an entity. So whether that entity is an LLC or if it's an S Corp or a C Corp, how is that structured? What's best for what opportunity you're seizing at the moment? Because these can be flexible. You can change them. Don't ever forget that. We want to make sure that it works with your business strategy. You also want to have a strong team behind you. To think that you can do this by yourself and take it to market by yourself is just unrealistic. So I'll tell you that right now. I'm being blunt and honest. I've seen people try to do it and it doesn't work because everybody is given the same amount of time in a day. We can't produce 48 hours of work in 24 hours a day because we all have 24 hours. So the more people you get on board with your mission, the better. And there's a strategic way to do that as far as you want to find experts, yes, but they have to really believe in what you're doing and they want to be motivated to help bring your idea forward. Now, your team could be an internal employee. It could be a business partner. It could be that you are hiring a contractor, or maybe you are working with a product development firm. So you find a regulatory expert and you don't want to pay them a full salary. So you pay them an hourly rate, or you hire a firm that does that. So there's lots of different creative ways to get things done, especially in today's world with all the technology. It's pretty easy. So you want to figure out what works best for you and what makes the most sense as far as your cash flow. You also want to have a strong advisory board. So in your particular therapeutic area, maybe you're looking at a diabetes product. That's what you are working on. If you don't have a team that shows, hey, I have this top doctor on board, or I have this entrepreneur on my board that he's done this, he knows the diabetes space very well. If you don't have a strong board like that, then investors aren't as confident because they want to see the expertise in that particular area. They want to feel confident that you know what your technology is and that it's been validated and that experts are on board with that. As far as the business strategy part, you want to look long-term. What are your goals? And you want to be able to pivot if the path that you're taking doesn't necessarily seem like it's the right path. You may start down it and then realize, I think I'm going to jump on over to this one. And that can be due to several different things. It could just be changing your mind or finding out, hey, this isn't working like I thought it would. I'm going to redo my strategy here. Or external market forces. Like, what if another recession happens or there's a change? So here's a really actually likely scenario. There's changes in our healthcare policy here in the US. We'll see what happens with this next presidency. How are things going to change if they are going to change? And how is that going to impact our industry as medical device? What does it mean for someone just starting out developing a product now as far as their strategy? Are you going to focus on, hey, I want a reimbursement strategy of this, and this is how I'm going to make my money, or maybe this industry is going to be flipped on its head and we want a different strategy. So that very well might happen. You also want to look at, do you want to take this product all the way to the market? Do you want to commercialize it yourself? Or does it make more sense for you to license the technology to other companies and have them use it in their technology? Or do you want to get it to a certain point and be acquired? And what makes the most sense? What can you do? Maybe you try two paths in parallel because you don't know what's going to happen, and that's fine too. So just having a plan, plan A, plan B, plan C, all the way through plan Z, whatever. You just need to keep your options open, keep your eyes open to what's happening, and just being able to shift with what's going on. Then we get down to your pitch. So first of all, how do you even get a pitch? How do you track down these investors? How does this all work? Do I raise money from my mom? Do I start a Kickstarter campaign? Do I go immediately to a venture capitalist? Or do I need to see an angel investor first? All of this is different for everybody. And there's a common path, I would say, that, common order that things tend to happen. But there's always people that don't follow that, and that based on their particular situation, other things just make better sense strategically for them. So you want to know that. So once you do find an investor to pitch with, are they even the right investor? Are they interested in investing in your particular technology? Like if it's an investment group and they like healthcare investment, okay, yes, that's very broad, but you want to look at their past portfolio of what they've been interested in before. And they know their spaces pretty well too. So maybe we talked about diabetes earlier. So maybe you find a group that specializes in diabetes type devices because they're passionate about that. They know the space well. They're going to be able to be a good investor to have in your corner. But if you came to them and you started talking to them about orthopedics, they might say, wait, whoa, I don't know anything about this. And I don't want to invest in that opportunity because it's too risky for me since I don't know much about it. So you want to make sure that it's the right person that you're pitching to. Then when you pitch, what goes into that pitch? What goes into the slides? What are you saying versus what's on the slides? We've all been in that boring PowerPoint presentation where you look at the screen and it's all words. Like there's like 10 bullet points on there. And what the speaker is saying, the speaker is just reading what's on the bullet points. That is not what to do, by the way. Don't do that. And if that's you, change it. Learn how to do a good PowerPoint presentation. There are so many YouTube videos out there. So anyway, I'm not talking about a presentation here. I'm just using that as an example because we all know it's painful. So pitches are the same way. You want to engage your audience at the moment, which is your investor. You don't want to bore them. You want to have the screen as a reference point, maybe a picture, some imagery, something to really connect with the words that you are saying. And how are you presenting? Different things like body language, how you dress, what is your personal hygiene, and how are you coming across? How are you delivering it? We're going to look at all of that. And in my program, I say we're going to look at all of that. I do cover that. So you want to be thinking about those things. And one thing that people have a disadvantage of if you haven't done a lot of public speaking is just confidence. So I recommend to everybody before you start pitching, you need to practice public speaking. You need to get comfortable presenting in different environments. And you can simulate that environment. You can find an empty boardroom somewhere and you can rent it. Actually, there's a company called Regus, Regus, and you can actually rent a boardroom for a day or even just an hour, a few hours at a time. They have offices all over the world, so you can do this. And there's other companies that do the same thing, but that's an idea for you if you just want to simulate that stress level and that environment before you start pitching for real. Showing that you've done the work that goes into the pitch, because they're definitely going to ask you questions and you want to be prepared. You want to present them things like we covered on episode 36 before. Hey, here's all of the market research that I've done. Here's what we've found. Here's the engineering data we've done. This is our concept that worked, that didn't work. Here's the usability and the user feedback that we got. You want to be able to know, to make it seem like you know what you're talking about. And you should know what you're talking about because if you've gone through this process correctly. So it's not like someone can just have an idea and go pitch for money. It is not easy. And a lot goes through it. And that's what I'm really passionate about. I'm passionate about helping you see the whole process and what really goes into it to set you up for success. Because we ultimately want the goal of advancing healthcare forward, bringing these ideas to life. That's just really exciting. When you're pitching, you also want a compelling story. You don't just want to dive into what your product does, but why are you passionate about it? Can you tell a story that connects you to your product? Or maybe you tell a story about someone else that's using your product. Or that's bringing in the human element of things. And people always connect with that. It's easier for them to relate to something if there's a story behind it because they themselves have either gone through something like that or they know someone that has, or if you're telling a story about yourself or someone else, they see that and they're able to connect to that too. Now, the next one is why you? So why are you the one to drive this technology forward? could this technology exist on its own without you? And could someone else drive it forward? So you got to think about that too, positioning you and your team as, hey, we are the ones to do this, and this is why. You can explain what makes you and your team special to help drive the product forward. So again, all of this I cover in my program, and this is just a snapshot of that, a high-level overview. It's also just an educational opportunity for you to find out more of what's involved in the process. And, a lot of people think they want to develop a product, and then they realize, whoa, this is way different than I thought it was going to be, and it's not as easy as I thought it was going to be, and I don't want to do that. And that's okay. With me, in my life, I went and got my bachelor's degree, and I started working, and I thought, oh, well, I think I want to go back to school for physical therapy. And I started working in a clinic, and I thought, I'm working with physical therapists, but I see what the doctors are doing, what the physician's assistants are doing, and I think I want to do that. And so I talked with them more. I got to see what their day was like. And then I started taking classes because it had been so long since I've had those undergraduate classes that when you apply for any medical education program, they make you redo those prerequisites. So I was in the process of doing that and suffering through chemistry class again. And I thought, you know what? I don't think I want to do this. I see what's going on here, and my passion for the business side of medicine was just really growing. And I thought, I'm just going to stop this. And I looked at what I wanted, what I thought I wanted, and then I pivoted because I figured out this is not for me. And if you do that, that's okay. That's great. You're finding out, you're taking a chance on something, and you're just doing it. So no matter what you're up to in life, I hope that's really valuable advice. That, I guess, number one, it's not too late to change. And number two, it's okay if you do change, and you can always change your mind and do something else. We only get one life to live. So you got to take advantage of it while we're here, still kicking. All right, so I'm wrapping this up for you today. Again, I just want to remind you of Device Talks, December 12th at the Fairmont Newport Beach. Come see me there. Come meet Brian Johnson himself, and we'll have a good time together. Then also, if you want to be a part of this program and you missed the boat on the beta version, that's okay. It's not too late. Just head on over to imua-services.com/IIPP to take advantage of your $750 off. That offer ends at 11:59 p.m. on December 31st. So you got to take advantage of it this month, and I will see you in the next episode. And I promise I'll have a guest on there, so you're not just listening to me ramble. Take care, everybody. Imua.
Mahalo for joining us. If you're new to riding the waves of medical device product development, or if you've been in development for a while already, Inspired by Imua is here to surf with you. Want to be a master of the waves? Text HANG10, that's HANGTEN, to 44222. We'll send you the most common wipeouts companies make in product development so you can avoid them and reach master wave status. Again, that's HANG10 to 44222. We publish a new episode every Tuesday, so catch us at inspiredbyimua.com. Imua!